Welcome to Talk with Maria. I'm your host, Maria Santiago. Today we're exploring how a home health aide career can lead to a fulfilling nursing profession. Join me with Celeste Martinez and Teresa D. Carrasquero, two inspiring individuals who started as a home health aide and are now nursing graduates. How are you today?
I'm amazing. How are you?
Good. I know you've started a long journey as a home health aide. It started off with just dawning on you one day at Party Supplies that you needed to change your plans. Tell us about this.
I was working a lot in retail, a lot of dead-end jobs, and I just needed to do something better for my life and for my son. And at the time, I don't have my son, but better my life for my son and any future kids I had. And I just had to do it.
Tell us a little bit about how you started.
I started because I wanted to get out of retail, and I walked into an agency, a home health care agency in, I think it's Hicksville, and I said I need a job, better myself, and it just took off from there.
Nice. So you went to the training school, you acquired your home health aide training license, and what happened after that? How was the school?
It was amazing. I had an amazing experience there. Everybody, especially with you there, that day in your office, I know you wanted to kill me that day, but you did it. You got me in, I was in, and it's just an amazing experience up until today. I've always have good memories of there.
You started working. Tell me about your first job.
The first one was well, I had several ones, but the one that stuck with me the most over the years was an elderly gentleman. Was working with him and the family for, 6 years? And my family's grown to love him. My kids call him Grandpa, and it was just a loving relationship. I still have contact with the family today,
Nice.
so many years later.
That's wonderful. I mean, I know you did an excellent job with that family. They became like your own family.
I actually saw his daughter on the way here today,
Wow. What amazing.
and she's always grateful for everything I've done.
Yes. And did you tell her you was going to be in a Talk with Maria
Yeah.
show?
Yeah, I did, and she was very excited and happy for everything I've accomplished so far.
So I know that your grandfather played a great deal of importance in your life as an elderly as well. Just tell us just a little bit about him.
My grandfather
He's a musician.
was a musician, a comedian. He has he had a whole track of trades of everything that he's done in his life, and he was just always a happy man, always telling jokes, always singing something, telling jokes. Every time you're around, you could do nothing but be happy and just laugh, and he always had you laughing somehow.
That's wonderful. And you're always laughing too with your patients.
I'm always bouncing
And that's why
around.
they love you so much. I knew at the end he was blind and
Yes.
you took care of him. You took
Yeah.
such good care of him.
My mother and the family in general
Yes.
took very good care of him, and right up until the end.
And that inspired you to move on to becoming a certified nursing assistant.
Yes.
Tell us about your journey there.
I went back to the Home Health Training Institute in Westbury, and again, Maria, you opened me with welcome arms again, like I knew you would, and just got my certification as nursing assistant. And by that time, I was like, I knew this is what I had to do. It was like, it made him happy that I was returning back to finish and do more than just home care.
That is so inspiring. To become a home health aide is one thing. To go to the Home Health Aide Training Institute and be welcomed and be trained by a wonderful registered nurses, and then to decide, you know what, I'm not going to stop there. I am going to go on to be a certified nursing assistant. That means you've now left the home of caring and you're going into the hospitals and the nursing homes. There's a great shortage of certified nurses aides missing in those departments. So if you'd like to become a certified nursing assistant, don't just stop at being a home health aide. Spread your wings, fly, become a certified nursing assistant. It's almost like if you're a nurse, but you're not a nurse, you're one step away from a nurse. So now you become a certified nursing assistant.
Yes.
COVID comes in, you're working in the hospital.
I was working with the elderly gentleman. I was there, and I spoke to the family. Said, "Listen, I love you guys, but I have to go to the hospital.
Right.
This is where I'm needed." I see, and they understood. I went into the hospital that first day. It was emotions like I've never felt in my life. And I know I called you up that day.
Yes.
I cried in my life, but not like that.
Wow.
Not like that. I saw the picture comes to my mind talking about the very first patient I had.
I remember that very first patient, and I remember that very first phone call.
All I did was walk into his room, full hazmat get up going. All you could see is my eyes on the goggles. That's it. And I had no problem doing that. I walked in to go take his blood pressure. I couldn't find my pen. I legit just went, shifted my weight back to one side to the other and back, and he was gone.
Wow.
Just like that. I didn't even move. I didn't move a step, nothing. He was gone. The guy was gone. And I went through the motions of doing the post-mortem care and everything, and it really hit me. This is where I need to be. And I went through COVID there.
Wow.
And
I know you went through COVID there. COVID was a very trying time for all of us, but for you, you resonated with COVID like nothing else. Celeste, we have not spoken with you, but you have so much to say. Welcome to the Talk with Maria show. How are you today?
I am well, thank you.
I would imagine Teresa had so much to say about her experience from COVID. We want to know all about you, all about your journey. Celeste and Teresa, we have to take a short break. When we come back, we'll continue discussing the path from home health aide to nursing. Stay tuned.
You know you don't have to wear your PT gear anymore, right?
It's comfortable.
So how's civilian life treating you?
It's fine.
When I got out, I didn't want to admit that there was anything wrong because I felt like a failure. And then I realized, like, there's nothing to be ashamed of. So I started talking to someone. Maybe you are fine, but if you're not, it's okay.
Thank you.
If you or a veteran you know needs support, don't wait. Reach out. Find resources at va.gov/reach.
When I was growing up, my mom was extremely tidy. We were trained to put things back where we got them from. One day, when I walked into my mom's house, I felt like I walked to someone else's house. There was stuff everywhere. And just growing up the way I grew up and to see this transition was very alarming.
When Sean talked to me, it was a wake-up call, and that's when I went to the doctor.
Welcome back to Talk with Maria. We're exploring how a home health aide career can lead to a fulfilling nursing profession. With us today is Celeste Martinez. Celeste, welcome.
Thank you, Maria. Thank you for having me.
Yes, how are you?
I am so happy to be here. I am well.
Wonderful. So now you went from coming from Trinidad to leaving a profession. Tell us all about your past profession and what led you to want to care for seniors.
Well, Maria, I migrated here 2 years ago. I am from Trinidad and Tobago, and I came from an industrial relations background. I worked with a prominent trade union for almost 20 years.
Wow.
And so I came to the United States to start a new life. I had no idea which direction I would be going in, but a friend of mine recommended the Home Health Aide Training Institute in Westbury. Wow. Now, I was all the way in New Jersey. I didn't know how to get there. I used Google Maps. I took the train and I found my way. And I was so amazed that I was welcomed with open arms. I jumped right into the class. And I began learning about how to give care. You know, it wasn't a hard transition for me. I think coming from an island, care is what we do. We're a warm people. We give love on a daily basis. I come from a family where we care about each other. Wonderful. So making that transition, you know, from an industrial relations background into home care wasn't so hard. You know, and I found a family in the Home Health Aide Training Institute. Being so far away from home, you know, sometimes you feel a little alone. But I really had great support till today. You know, those guys there, yourself, Maria, are like my family, my second family.
Wonderful. So you had patients once you graduated, you started caring. How was your first patient experience?
It was a nice experience. I became part of their family as well. Like Teresa said, just learning how to take care of someone day by day outside of the classroom. It was a whole learning experience for
Obviously,
me.
because you're in the classroom, you understand and care, but then you're out of the classroom and this is a live person. You have to feed them, you have to talk with them. It is at the worst point of their life. You have to understand the family members. You have to understand if they want to eat, if they don't want to eat, how you're going to spoon feed them, how you're going to change music to make them feel better, their entire scope of just comfortability.
Yeah, and cultural differences
And
as
cultural
well.
differences makes a huge difference.
Yeah.
And so you have to position yourself really well.
Yes.
Teresa, I know you've worked through this entire plan as well. The compatibility effort is amazing.
It's every patient is different, and following what you said is like learning it in a book is one thing, and then going live in a patient's home is another. It's like it's not a mannequin in a bed, it's an actual person. So you have to learn how to push, in a sense, to roll them over just enough to not hurt them, but to get the job done.
So Celeste, you managed your first patients. We moved on to other patients. Now you're really enjoying home care. You're understanding the senior life, which is so important. We never want to forget our seniors. One of the reasons why we're doing this show is to enhance the understanding of home care, to understand seniors, to understand that these were the folks that made our history, and that we're not just to leave them alone or just forget about them and never call them in a week or two or be angry with something that they did 100 years ago, but rather than to embrace them and culturally understand the love that we have to show to each person as we go into their homes. So now, there's a twist. You decided you want to become a nurse, like Teresa. So tell us about that.
Well, Maria, I decided to use my experience as a home care to connect with my patients on a different level. I wanted to know a little bit more about how the human body works.
Oh, wonderful.
How medications improve health. You know, you're sitting with your patient as a home health aide, you're seeing the medications being given. You see that it does help, but I wanted to go a little bit further and get that understanding for myself. At the same time, this transition helped me to solidify my own belief in the power of perseverance.
Wow.
So, you know, it was a personal challenge for me, and I really, really took it by the horn and I went with it.
I am so, so happy for you. You went to nursing school, you graduated as an LPN, just like Teresa did. Congratulations to you both. I know, Teresa, you got an award from the Barbara Novak Scholarship Award, and you took that award and went full schedule with it. I applaud you. You were just amazing. You went through the COVID feature. Celeste, you did the same thing. In 9 months, you became an LPN, and this is a new journey that you've started. So Celeste and Teresa, the Talk with Maria show went on the road, and we recently caught up with some healthcare professionals. Let's take a look at who we met.
Let's do it.
We'll be right back.
Eva Marie smoked 12,000 packs of cigarettes over 15 years. She quit, and now there's a new lung cancer screening that could save her life. You stopped smoking, now start screening. No matter how much you smoked, early detection could save you. Talk to your doctor or learn more at savedbythescan.org.
I tell my son, I love you every single day. Now, my dad has never said that to me. Not because he doesn't love me, but because culturally it wasn't comfortable for him. Now that he's a grandfather, he says, I love you to my son every time he sees him. My advice to all the fathers out there, forget the cultural restrictions. They grow up way too fast for you to waste even a single precious moment.
I'm elated to be here in the home care arena. It is the show that the wonderful folks of Powell have put together. Home care people, anyone that's in home care ought to be here today. We deserve a day, and this is our day. But when you run into home care, union president. Now that's a big day. Joe, tell us all about what you do, where the diversity is going today, what's on your mind. You play an extremely special part in home care. You bring a lot to the table.
We represent a little bit over 42,000 members, mostly residing downstate in the 5 boroughs of New York City, Rockland, Westchester, and Long Island. It's an honor to advocate for some of the hardest working people in New York State. The majority of our workforce is female, women of color. For a lot of them, it is their first job in America. I've been involved with the labor movement for over 26 years. Then I kind of transitioned to learning more of the benefit side and, preparing and creating benefit packages for unions. And, our mission is to improve the standard of living, for our members. It's easy to care for our workers. They are so hardworking, and we have a lot of work to do with them. What's going on? They're some of the lowest paid, across. These are women literally on the front lines during the COVID pandemic. They were seeing, our people, their clients, that sometimes they were the only people they were seeing, during COVID. They weren't even seeing their family. And our people were using mass transit. They were there, definitely on the front line. We had to fight, to get them to be considered healthcare workers. They weren't even available to get vaccines, and we had to go to the state, in the past, governor to say, we are healthcare workers, we need access to the vaccine. They agreed to it. But it's kind of that advocating and just bringing them to say, these are the people that are taking care of your mothers, of your grandparents. These are vital people. People don't want to be in nursing homes. They want to age with respect and dignity in the home. And this is part of the largest growing workforce in America. And what we're trying to do is change people's idea of how to age in America and build a career ladder for our workers. We want them to be more trained, get more resources. This industry is plagued with retention issues, with recruitment issues, and we think putting the resources to take care of the growing demographic of people 65 and older in the New York State, in America, that we have to invest now in our own people so we could take care of each other.
The wonderful thing about your union is that you bring the cause and effect. You can be trusted to negotiate, to get paid, to talk and come to a medium. And that is just an amazing piece. And I think once people understand union understanding a little bit differently, it would make home care less cumbersome, because there's a mediator. There's someone that both companies can come between and say, hey, I don't like this. I like this. Could we fix this? I didn't like this. And it saves time. So I think all in all, having a union is beneficial, and it's important. There's a lot of movements with the CDPAP going on now. There's a lot of movements with home care. Medicaid has cut back on a few things. All the governors are working very hard to make sure that things are going in the right direction, that the moving pieces of care, because at the end of the day, people are sick. They need care. We can't let our seniors just fall apart. It's your last quarter of the year. What are your plans?
There's a lot of work to do. You mentioned the current environment with CDPAPs, what's going on with HHAs. We have to work in coordination with agencies, with employers. Their employee is my union member. It's the same person. So we found working together that we have the same goal. We need to get more, we have to convince the Department of Health, the governor, to put more resources into this industry. We have to speak with one voice, and I think our chances are better when we work and coordinate with the agencies. Again, their employees are our members, and speaking with one voice. Who better than the members who are there with the clients to speak their voice and say, this is what this industry needs. We want Albany to hear all our voices from the people who are doing the work every day, so they can hear us loud, our loud voice, and hear us, so they know what to do to make the right choices. And we have to educate them and guide them, so they know so.
If one would like to get in touch with you, give us some information.
So with Home Health Care Workers of America, you could go to hhwa.care. Home Health Care Workers, we're part of a larger union, the International Union of Journeymen and Allied Trades. So you could go to our website at hhwa.care and also IUJAT, and we'll love to hear from you.
I tell you, the Home Care Show really had a dynamic idea of putting all of us under one roof. And guess who we ran into? Mr. Churchill Egon. He is the executive director of Latch Home Care. What made you decide to have a home care agency?
Looking around to see my community in Yonkers was a community that needed home care. We needed a community agency. They wanted someone they could reach out to. They needed someone that they could talk to. They needed someone they could discuss their home care needs with. They needed someone that could give them the advice. My grandma is very, very sick. I take care of her. I don't know what to do. I don't know how to access Medicaid. There's nothing out there saying if grandma needs home care, this is the number to call so they can get examined by the state. Even in cases where the managed long-term care has only approved 5 hours a day for someone that's bedbound, I can tell you all kinds of stories. So I'm very proud about the work we do with our community. And I want to thank you because I look forward to working with you and getting more people trained so they can provide better care.
Give us your number and the email address, the website, that one that wants to come in and join your company can come by and join so that your lack of home health aides can be remedied.
I could give her my personal number because my personal number is 914-843-3217, and it's called Lash Home Care. Easy to remember, LACH, Lash Home Care Services. We do provide services in the Bronx, Queens, Long Island, Brooklyn, just name it. We're all over there, over the places.
With me is a wonderful nurse, Shayna Finkelstein. I'm so happy you stopped by. 44 years a nurse is nothing to sneeze. What do you think about home care in today's world?
I think COVID helped us to really learn how to step out of the box and make things work. And I think it's a great nursing thing for people because people look at home care as if it's easy, it's not complicated, it's not like hospital nursing, but you'd be surprised. There's many, many disadvantaged people that we're helping. We help them get Medicaid, we help them get, home care services put into place, and we really advocate for them. So I think I found my niche.
From the minute you're not feeling well and you call that card, I am not well, and I need more than just to stay home with my family looking in at me. I need an aide. I need a nurse to come home. I need somebody, I need doctors. I need in-home doctors. I need to see more than one thing. Depend on the disease that they're encountering. It's very hard. And you as a nurse, you're seeing all types of diseases.
And we also service a pediatric population. It's not just your geriatric, special needs children. It really runs the gamut. And you have to really be a great multitasker and know how to tap into resources. And as a DPS and in home care, we do everything. I think we have a way to go, but I think we're doing okay.
Look at how many people are here in today's arena. Everyone is playing a part, from communications to digital to mobile home care to setting up wound care services to us moving into all the agencies that are supplying the aides. It's a supply and demand.
Well, first of all, we need home health aides. Not enough people are going into the profession, and we lost a good deal of aides with COVID. So, training is important.
Tell me a little bit about Caring Home.
We've been in business for about 25 years. Started out in a small agency in Jamaica, Queens. We have moved now to Ozone Park, and we have 2 other locations, the Bronx and Brooklyn.
And so you're the director of nursing?
Only full-time nurse, but half of those patients are CDPAP, which we have limited clinical involvement with. But now we're doing NHTD. I don't know if you're familiar with that. So that's been interesting. keeping patients out of a nursing home is that focus, yes.
I applaud you for being a nurse and applaud you more for being a home care nurse. Thank you so much.
Thank you. And I wish that more nurses would really consider home care as a profession, because it is really rewarding and it gives you that flexibility that a lot of women need. So go home care.
Home care needs nurses. So if you're planning on a new career, like Shayna said, be a nurse.
The impact of a meal goes well beyond feeding our bodies. Because when people are fed, futures are nourished. Everyone deserves to live a full life. And with your help, together we can end hunger. Join the movement at feedingamerica.org/actnow.
Welcome back to Talk with Maria. We're exploring how a home health aide career can lead to a fulfilling nursing profession with Celeste and Teresa. Celeste and Teresa, we're back on. We love you guys so much. Thank you for taking the time out of your life. Because some people want to be an air stewardess, some people want to be an engineer, an astronaut. You guys decided, you know what? We're going to take care of the human body. We're going to take care of people at home. We're going to go into the hospitals. We're going to be the first point of contact. Teresa, what's your next plan?
To keep going, to become an RN, and just as far as I can go.
I know your mother has guided you tremendously.
My mom.
We have to say kudos to her.
My mom, she's the biggest cheerleader with my kids and my family to me. Of whatever I want to do, she's right there.
Yes.
You want to do this?
Mother.
Go ahead. You want to do that? Go ahead.
And she was a principal of a high school.
Yes, she was. A middle school in Queens.
Middle school. Amazing. And has a PhD as a doctor.
Yes. PhD
Wow.
as a doctor, yes.
Unbelievable.
Yes.
Listen, God has blessed you tremendously, and that's such a blessing.
I have a lot of people in my family that also influence why I chose this route also. Not just my grandfather, my aunt who was a nurse also.
Nice.
A labor delivery nurse. She's
Wow.
actually the nurse, for me, the story goes is she was my nurse when I was born. My mom couldn't see me, so my aunt took care of me in the nursery.
Nice.
So it started
So
from
right from birth.
The seed was planted.
Yes,
then.
right from birth you had the seed planted. And Celeste, you are now on your journey as a nurse. How do you feel about that?
I feel great. I feel like I am finally on my way to accomplishing my goals.
What would you say to someone that wants to become a nurse, that have been a home health aide, that have studied to be a CNA, that now wants to take that journey? I know 9 months is hard planning, studying, understanding all the trajectory of nursing. What is your advice to someone?
I would say just start.
Just start.
There are so many things screaming at you. Now is not the right time. Put it off for tomorrow. Just start. And I find when you just start, the path clears.
I totally agree. Teresa, would you say that?
I would say the same thing. I had to do something to keep improving my life. I have my 2 kids that I need to do better for them eventually, in their lives, and show them that it's never too late to start anything.
So we're going to leave. Never too late to start anything. Thank you, Celeste and Teresa, for inspiring us with your nursing journeys. Remember, continuous learning is the key to success. Utilize American Association of Colleges of Nursing to propel your nursing career. Visit our website, talkwithmaria.com, for more resources and information. Share your thoughts on social media using #TalkWithMaria. Tune in next time for more inspiring discussion. Until then, take care and take action. Love you. Talk with Maria is made possible by, if you're passionate about helping others, become a certified home health aide with Home Health Aide Training Institute, 516-333-3689, or visit hhati.com. Experience the authentic taste of Italy in the heart of Westbury. Rialto Restaurant. Make your reservation at 516-997-5689. Brooklyn Boulevard Home Care. They care for you in the comfort of your own home. To schedule your care, call 718-683-8303.